So that's the treatment piece. Let's talk about more of the assessments. So in the assessment process, there are different levels of assessment that we're going to be involved in, and which you use or don't use may really depend on your practice setting, your population, okay? You may have intake information that's needed, and this often goes along with screening, whether you do the screening, screenings are being done by other professionals, okay? Identifying whether or not somebody needs a full evaluation. Do they likely have a problem? We may do interviews, and interviews with adults is something that is really a necessity. You really can't get full information without doing some kind of an interview. And that's something that's quite different than we're used to doing with children. You know, we're pretty used to just testing kids and going with that, but with adults, you really have to talk to them, and you will probably get your most important information through that interview. Then direct assessment. It is necessary to do direct assessment of your adult clientele. That direct assessment might be self-reports through questionnaires, but it should also incorporate different direct administered assessment tools. Okay, so whether you're doing the BOT, you're doing a perceptual test, whether you're doing some other test, okay, we have to do that direct assessment. You never ever just use a sensory history, all right, as the only way, unless you can't get cooperation from the adult. And that does happen. We do also want to look at behaviors. And if you're dealing with clients that are on the autism spectrum, are cognitively delayed, you know, have other kinds of issues, there may be behaviors that we need to look at. And those behaviors can tell us a lot about the client's sensory processing and skills, okay? And even your children with trauma and attachment issues. I feel like there are a lot of behaviors related to that can reflect their sensory issues. And I will say that particular population, you can almost guarantee there's going to be a sensory issue. That's sort of the next frontier, I think, in sensory processing is trauma and attachment. And it's just booming these days. And they're talking more about it with children, but it's soon those children are going to be adolescents, and then they're going to be adults, and we're going to have to be, it doesn't go away. Yeah, we're going to be having to deal with that population. And it's going to be a population that has grown up with sensory awareness. And then we want to integrate all of this information into some kind of a meaningful profile. Okay. So let's talk about what tools we have, okay? This is what you want to know.